It's Dr. Lorna Halliday once again. Today, I'm talking with you about consequences of alcohol abuse. I have identified 7 nutritional consequences that occur as a result of alcohol abuse. Now, the first consequence that I want to mention is alcohol's effect on digestion and nutrient utilization. Alcohol tends to damage cells that line the stomach and intestine, and this in turn would affect nutrient absorption and the ability of some nutrients to be transported into the bloodstream. Folate is a great example of a type of deficiency that occurs in association with alcohol abuse. Many alcohol abusers may consume as much as 50% of their daily caloric intake from alcohol. This is usually to the detriment of nutrient-dense foods and essential nutrients. In addition, alcohol can adversely affect mechanisms by which the blood glucose levels are controlled. Therefore, in someone who abuses alcohol chronically, they are subject to irregularities with hyper and hypoglycemia. Now, thirdly, research findings have suggested that alcohol affects protein metabolism adversely. By doing this, it impairs protein digestion and also the impairment of protein processing by the small intestine and the liver. This now results in impaired cell structure. The compromised nutrient absorption that I've been mentioning and metabolism as a consequence of alcohol abuse can in turn lead to overall impaired bodily function. Now, I mentioned folate as one of the typical nutrient deficiencies that occur in alcohol abusers. However, I want to, as a fifth consequence, I want to talk specifically about vitamin deficiencies and manifestations in conjunction with alcohol abuse. As I had mentioned in another blog post, vitamins are essential for regulation of many of our bodily functions, physiological processes, and they function as coenzymes in the body. As a result of the chronic alcohol consumption, vitamins such as vitamins A, D, E, and K are affected as a result of inhibition of fat absorption as a result of the alcohol. Now, in terms of the water-soluble vitamins, vitamins B, thiamine, folate, and vitamin C, these are also affected by alcohol abuse. And added to that is the fact that alcohol has a diuretic effect. So there's increased urine production, and these vitamins are also easily lost within the urine. Sixth would be mineral deficiencies that also result from chronic alcohol consumption and alcohol abuse. Mineral deficiencies such as zinc, iron, calcium, magnesium, these all occur in conjunction with either fat malabsorption, decreased intakes of persons consuming alcohol chronically, increased urinary excretion, vomiting that's in association with alcohol use, possibly diarrhea, and gastrointestinal bleeding, among other routes of loss. And I have put together a couple of medical consequences that occur. In pregnancy, for instance, if we have alcohol abusers who are uh, struggling with alcohol during the time of pregnancy, this can have a very serious effect on the fetus, toxic effect, contributing to fetal alcohol syndrome, etc. Uh, Nutrients definitely, which may already be restricted by the mother's intake of alcohol, also would be restricted in terms of flow of nutrients to the fetus, compounded with nutrient deficiencies that may already exist in the mother. And this can trigger uh, effects in the development of the fetus as well as contribute to congenital anomalies. There are effects on the brain. Nutritional deficiencies, notably thiamine, as I had mentioned earlier, they have been known to cause severe neurological effects in persons that chronically abuse alcohol, and also adverse effects on brain function. Liver disease and pancreatitis are also conditions that also may develop in conjunction with chronic alcohol abuse. So these are seven nutritional consequences, some involving some medical aspects that occur commonly in persons who chronically abuse alcohol. If you would like to speak with me further on this topic or to see more on this topic, you can contact me at my blog at https://www.letstalkhealthandnutritionwithdrh.com. I can also be reached by email at heiledignutritionconsulting@gmail.com. I look forward to chatting with you very soon. Bye now.